you for reminding us. It's being recorded for the benefit of people who can't attend. So thank you for reminding us of that. And recording has just started. Okay, great. We're all on the same page. So I'm going to stop talking now because I do tend to talk far too much. I'm going to pass the baton to Therese, who will give us an overview of what's being done so far across the UN system, and then we'll have questions and answers toward the end from you, and any reflections from you would be more than appreciated, as well as how you think FICSA could push further on this issue. Thank you, Therese, and thank you, Paola. Over to you.
Thank you, Tanya, and thank you to you all. FICSA for me is a really important partner in this work. So Tanya, thank you for all of your amazing work before I came on board, and then since I've come on board, you've been an absolute champion in so many corners of the UN to really push this issue. So it's been really appreciated. And I think the key thing around this is we all need to think about what role we can play to make this happen. So while I have a slightly growing team, for the first 12 months, it was just me in this role. I'm working across the whole UN system. So sometimes when people go, well, what are you going to do next? It's like, well, there's just me. We all need to be working out what we can do. How can I best provide that support so people can take action with it within their own arena? And this is very much an interdisciplinary approach. And I think that's what's been one of its measures of success. So on the implementation board, we have representatives from most of the UN organisations. And if you are in a UN organisation that doesn't have a representative that you know of, and I can give you that information, you know, where our aim is to have people from all of the UN organisations taking part, so that it is a collective effort in the work that we're doing. We also have representatives from the councillors, obviously. So there's a number of councillors. We have a representative from UNSCG and one from CISMO, which is the Critical Incident Stress Management Unit. We have a representative from the UN medical directors, obviously from HR, from the Ombudsman's Network, and most importantly, don't tell the others I said that, the staff federations. So we have representatives from each of the staff federations really pushing this work. And I think that is really important because we all come from different perspectives and we all have a role to play. So it's making sure we can work together in the work that we're doing. So I definitely would like this to be a two-way conversation. We're in the midst of our planning cycle for 2021, and I'm really interested to hear your perspectives both on the sort of the actions that you think are absolute priorities that we can't not have on the 2021 plan, and also how we can best work with you, because you're our voices on the ground, you're our advocates out there. So how can we make sure we're giving you the tools so that you can also be out there and pushing the issues that we're talking through? I'm going to quickly go through a PowerPoint slide just so I don't go too far off track in what I need to say today. I know a lot of you have been involved in the mental health strategy, but I think it's good to just make sure we are all on the same page to start with. Now, is that sharing? Oh, I don't see a red circle, square.
Not yet, Therese.
Let me try again.
Irwin, can you just check that Therese has? Oh, there we go. Here we go. Here we go. Brilliant. Thank you.
I've got my red square now. Last year we did a bit of work around branding. So the title of the strategy is Mental Health Matters: A Healthy Workforce for a Better World. So this is really pushing the idea that we're doing this for ourselves, we're doing it for our staff, but we also know we actually can't do our work if we're not healthy. So it is really important for ourselves, but also in the work that we're doing. It is so important that we are mentally healthy, that we are doing all we can to support staff over this time. Tanya gave you a really good overview of the history, and again, that was a multidisciplinary process that everybody had a role, so all of the different disciplines had a role in putting the strategy together. Then the link to the strategy is on the website that's already been shared, and there's a lot of detail in there, which can be hard sometimes for people to step out and go, well, what does this actually mean if we're thinking about implementing it? So I'm always looking at what's the best way to actually synthesize this in a way that it's useful. For myself, I find the easiest way is to talk about the strategic themes of the strategy, because people have a different vision of what does mental health actually mean. Is it about our counsellors and providing psychosocial support? Is it about our working conditions? All of those things are important. So the first strategic theme is to create a workplace that enhances mental and physical health and well-being. So that is about our working conditions, our working environment, our leadership, our managers and leaders, how they support staff, how we work as a team. All of those things play a role in terms of mental health and well-being. Now, we know there's already a lot of things happening in this area. So when we go to talk to organisations about what can they do, one of the first things is working out what are you already doing. So we don't need to presume we're starting from scratch with everything, but enhancing our sense about what actually creates a healthy work environment. And one of the things that I've actually been talking about a bit this week, because I think we all hear stories of where things don't go well, around where some managers still want to have a lot of control at the moment over staff and make sure they're sitting at their desks from 9 to 5, even though they're trying to look after children and their parents and everything else that's going on this year. One of the things that I think is important in this space is thinking about job control. How can we give people some level of control over the job that they're doing? And that's not saying, we can all do whatever we want, but some simple things for managers to say, do you know what, this person can't work and start work until 10 o'clock. It makes a world of difference if they can get their kids started on their online learning or get them to school. So giving people a level of control over their jobs and the way they work, I feel is actually really, really important at the moment, because the world is so uncertain and people are really struggling with the uncertainty of that. So how can we give a level of control, at least in small aspects of people's day-to-day work? So there's a whole range of things we can do, we're already doing, but I think with everything I'll talk about today, it's like we've made some steps, and we've got an opportunity now to really enhance and push those things forward. Going back to the strategy, so it's a 5-year strategy. So we're moving into year 3 next year, which is sort of the middle year. So it feels really important to make sure we're really putting steps in place so this is sustainable in the long term. So that's the first strategic theme. The second one is about developing, delivering and continuously evaluating mental health and wellbeing services in all duty stations. So obviously mental health services can be a whole range of things. The key in the UN system obviously is our counselling network. They do an incredible job in providing support to our staff. We know that there is still not equal access across the system. There has been a lot of work done over the last couple of years to look at that, to look at different delivery models. And I know some UN organisations are looking at different methods so that we're able to make sure the support is there. The other aspect of that obviously is the quality of those services. So there is more work been happening around ensuring we have quality systems in place so that the services that are offered are at a high quality and consistent with professional standards. So the other challenge, I think, just around the health and wellbeing services is that balance between working at a system-wide level, at a duty station level and at an organisation level, because the majority of the counsellors are employed at an organisation level, but we also know that we need to be looking at a duty station level, at a regional level, to make sure those resources are there. So we obviously still hearing stories about where there's gaps in the system. We're keen to hear about those, to look at what, if there's anything we can do at a system-wide level to assist in that area, but also to look at different ways that we can deliver with that. The other area I think around that is making sure we're aware of who are more at risk. And when I put my so I sit in the UN Secretariat, and I've been doing a little bit more work in that area. What we've done in that area is look at who are the groups who are who really struggle to access internal counsellors. So that is actually our counsellors, our healthcare workers, regional coordinators, our mediators office, all now have access to an external employee assistance program so that they can access additional psychosocial support if they need it. The third area is around welcoming and supporting staff who live with mental health challenges, and obviously this is key. One of the things I think is really important, Tanya mentioned the numbers early on, we need to make sure we are supporting staff who are experiencing mental health challenges now. One of the risks, I think, and I'll talk a bit about what we've done over the course of this year, because we know we've all had to take steps this year to consider how we look after our health and well-being, and we do need to continue to do that and be putting messages out around how can we support our own health and well-being, how can we support others to do that. We need to make sure that we don't lose what is really critical in this, is that we're actually supporting people who do have a mental health condition, and that this doesn't just become sort of a well-being strategy. There's a number of key areas around this. So obviously one is around stigma reduction and reducing discrimination across the system. We are seeing now people more able and happier to talk about their experiences publicly. Paola mentioned before the advisory panel we have of people experiencing a mental health condition. It's had a little bit of a stop-start history, and that I think was one of the first things I wanted to do, and I did do when I started, was do that. I soon learnt the challenge of there just only being me, so I apologise again to that group that I wasn't able to really make that group grow over the course of last year. But we've now recently reconvened that group. We've got a whole range of people across the system who are either inputting into the future of the strategy, giving input into what are the key issues, talking about their personal experience so that we're reducing discrimination, so that this around mental health and wellbeing and mental health conditions is happening more broadly. There's obviously then some really specific issues, and a lot of you are probably really aware of these in terms of making sure we've got really concrete support there as well. So that is looking at our return to work policies, all of the different administrative issues, Appendix D, all of the really concrete practical things that we can make sure we're not discriminating, and also we're making that process as easy as possible when somebody is experiencing a mental health condition within the UN. The Secretariat, who obviously plays a role with this, has recently convened a UN Secretariat mental health leadership team, and one of the first tasks of that group is actually to put in place an administrative working group so they can look, probably obviously focused on the UN Secretariat, but then looking at at the implications across the system, so that we know what are the issues that are there and what can we start to do about those. So I think that's going to be a really practical and positive step going forward. The fourth of the strategic themes is ensuring sustainable funding for mental health and wellbeing services. I like to talk about sustainability probably in two ways. Obviously there is funding, and then there is also making sure we have actions so that this is really deeply embedded so that it is actually sustainable going forward. And my goal around this is, in some ways, it's like, if I wasn't here, this would keep going. So it's not dependent on any one individual. It's not dependent on a number of individuals, that this is deeply embedded so it goes forth. Obviously, funding is an ongoing issue. It's an ongoing conversation. We've had some more funding this year. I've managed to borrow staff from different areas, so we've got more resourcing from that perspective. But there's still a lot more work to do in terms of ensuring we're actually funding this at a system-wide and UN organisation-wide level, so that half our jobs isn't actually just about trying to find the funding and resources to do what we're doing. So that's sort of, for me, the easiest way to talk about the strategy across those four areas. So you've got a sense that there's key areas that we're wanting to take steps on, both at a system-wide level and then at a UN organisation level. Tanya.
Thanks, Therese. I am going to anticipate what might be a question coming through from others, but I know that we also include prevention in there, but it's not obvious from those 4 strategic themes. So perhaps you could mention how prevention is addressed as well as you go through your presentation. Thank you.
Thank you, Tanya. That's a very good point. And I probably should have used that word when I was talking about creating a workplace. That the first strategic theme in my mind is around prevention. And it's the other ways that we can obviously talk about this is around prevention, promotion and support. So for me, prevention is around looking at the way that we work so that we are reducing the risk for staff due to our working conditions, due to the way that we work. We know that, there is always going to be risks in the UN that we can't take away just due to the nature of our work, but there are changes that we can make in the way that we're working that will reduce that risk. And that's where the way we work, our working conditions, our workplace culture, all can play a role in actually preventing poor mental health and actually promoting good mental health. So I think there's that positive element to it as well. The other elements around prevention are also, what we do for ourselves. So going back to what can we do to look after our own health and well-being? What can our managers do to make sure they're working in a way that supports their staff's mental health and well-being? So I always look at these things, I guess, across all of those things. What can we do as a whole workplace to reduce the risks? And I think one of the interesting things about the survey Tanya mentioned in 2015 is we know that there's high risk duty stations, that people experiencing trauma are going to be at more risk. But actually when you look at it, some of our headquarters duty stations actually had poorer rates of mental health than some of the areas where you would imagine it would be higher. So that's where things like social connection, feeling supported, going back to the idea around job control, there's a whole range of different things where some duty stations actually are having better mental health, when if you would look at it on a purely objective level, you would imagine it would be harder. So while we can't take away a lot of the difficult situations that we are in, the way we work can actually mean that we have better mental health, even in really, really challenging duty stations. So we need to look at what are the risks in each duty station, and this is where an individual approach is really required. It's like, what are the risks in each duty stations and what can we do to mitigate some of those risks, and how can we make sure there's things in place that people feel supported, that they feel connected, and that they feel a level of control over the work that we're doing. Does that answer that enough for now, Tanya?
From my perspective, yeah, that's great on a broad level. Thank you. And I'm sure other people will have more detailed questions when we get to the Q&A at the end of the session. Thanks.
So just going back, I guess, thinking about this from a historical perspective. So last year when I came on board, there was a lot of work, I guess, around really just embedding the work that we're doing, working out who the partnerships were. Still a number of barriers. I think there was still levels of resistance around us talking about mental health. So there was early work that happened last year around developing our website, doing a lot of communication, starting a number of priority actions around our psychosocial support. I think, as with all of us, we went into 2020. I had a beautifully written work plan that we'd worked on about this time last year. And then we got to March, and I was asked to suspend the work plan that we had, which obviously was in line with the next steps around the mental health strategy, and really look at what were the immediate needs. So in March, we did a quick rewrite of the work plan for the year, really looking at, I think really one of the key things was knowing how much was happening to minimise duplication of effort. So we knew that people were running the same training programs, they were running the same things across all of the UN organisations. So we did an audit of all of that so that we're making sure we're sharing the resources across the organisation. And then also looking at what were the key emerging issues, such as obviously dealing with uncertainty, managing within a pandemic, grief, loss, all of those issues that have come up this year, to make sure we're providing resources to staff around that. And then we've also, along with our partners across the system, have a specific wellbeing website on the COVID-19 UN website. So giving really specific advice for people during this time. The other things that, and obviously key to this, is around engagement and partnership. It's sort of, if we can have a silver lining over this year, is, I know last year I felt like I was banging on doors going, we need to be talking about mental health and wellbeing, trying to work out how I could get into meetings to talk about it. And then suddenly this year, everybody realised it was really important. So rather than me banging on doors saying, can we talk about this? Everybody's coming to me and saying, can you come and talk about this? So, you know, now I go to most HR network meetings to talk about the issues. I go to a lot of the different discipline-specific meetings, so that we're really working with others. And again, I'll come back and say the staff federations are absolutely key to this work. So that is really important. Information and communication. And when we go back to the idea around prevention, I know it sounds really simple, but and I'll talk about the Health and Wellbeing Survey, but what came up as key in that was communication. And that is not just communication about mental health, but it's communication about what's happening. We know that if we communicate exactly what's going on, or when we might be going back to work, or how the decision making is happening around some of those things, that gives people a sense of safety if they feel like they're being communicated to in a transparent way. So that is a really important level. Obviously, information both for our leaders, but for anybody across the organisation who is communicating with staff. I don't think we can communicate too much this year. We just need to keep pushing the information home in what we do know and also what we don't know, because we know we can't answer all of the questions at the moment. You'll be aware there's been a lot of review of policies over the course of this year, as we've all changed the way that we're working. Obviously, again, there's still challenges in that area, and I'm keen, obviously, to hear from you if there's any specific things coming up. But I do know that as policies were being revised, that health and wellbeing were absolutely core to that work. And again, I was going to say, not for the first time, but certainly as policies are coming out that could have an impact on health and wellbeing, I'm asked to look at those in many instances. So it is much more in people's minds, and that can be sometimes hard to see outside. And I work closely with the health with the policy team in the UN Secretariat, and I know that they've really worked hard within the system that they have to be putting staff's mental health and wellbeing at the centre of any policy changes. We did do a health and wellbeing survey, and this was actually initiated by our Vienna-based UN organisations, and it was, in the end, 13 UN organisations took part in that, and it gave us some really good information about who was what the different issues were in different aspects of the UN. And I can certainly share the overall report for that, and each UN organisation that was involved got an individualised report, but I don't have a copy of those. So we do know, and I think it's important thinking about our work going forward, that our younger staff, and when I say younger, that's anybody in groups under 45, really found it much harder over the course of this year. There's all sorts of reasons why that might be the case. Obviously, younger people, their social lives are different, so they may be more likely to be isolated at times like this, not as well settled, harder to be away from the rest of their family, looking after young children. But I think that becomes really critical going forward to make sure we're looking at how can we best support our younger staff. Again, we saw, as is always the case, I think, with mental health and wellbeing, we saw differences in gender. So our female staff reported poorer levels of well-being, and our male staff reported being more socially isolated than women. So I think looking at this from a gender perspective is going to be really important going forward. I won't go into more detail because I feel like I'm talking a lot, but I'll share the results of that survey, and Tanya and FICSA did a great job getting that and promoting that survey. So I do thank you for that, and it's been really valuable in different organisations planning their next steps, but also for us as well. The other thing, going back to the idea that we can make a difference in the work that we're doing, there was actually significant differences across UN organisations about how staff were faring over the course of this year. And obviously who those organisations are is a bit irrelevant, but it does show that we had, I'm going to give you a range of scores, which means nothing without the actual context, but we did the WHO 5 survey, and I think the highest organisation was around 80, and the lowest organisation was around 40. So that was based on the scores people were doing. So those numbers don't mean a lot, but it shows you that there was such a range in terms of how staff were faring. It was done just before, while we were all still in lockdown in various ways. So, and that was quite deliberate, but we still saw differences across geographical areas as well. For those of you who are Geneva based, you'll be pleased to know I think Geneva was actually scored the highest in terms of wellbeing, and for those poor of us in New York, scored the lowest. So that may be based on a whole range of different factors, but I think it is really important that we look at who is doing better and what is happening different in those organisations or in those duty stations. Some of those things won't be things that we can change, but some will. The next thing we focused on was access to psychosocial support, which I've talked about a little bit. I'm still keen to understand more about where the gaps are. It's actually really hard to get a really good picture around what's happening in terms of psychosocial support. We did do a bit of an audit last year, which was looking at things quite generally, but I know I still get calls around there's no support here or this is where there's a gap, and we can certainly work with our partners to work out what can we do around that and how can we have different approaches. And as I said, one of the things we've done in the Secretariat is increase access to external employee assistance programs. Another area which is related but not exactly mental health was around domestic abuse. So in March I was asked to put together a domestic abuse task force, which is again an interagency approach where we've got a domestic abuse website. We've been putting out a lot of information around domestic abuse. We've recently released guidelines for staff who are experiencing domestic abuse around what steps they can do within the UN system. And that really goes to a lot of the administrative issues as well. And that was quite an interesting process because we ended up talking to a lot of the different departments around what does this mean from a visa perspective? What does it mean from a pension perspective? We spoke to UNFCU, who are now putting in place a specific focal point in this issue. So we know there's increased risk at the moment. And again, another one of those topics that when the people, because I was new to this area, people have been really trying to push this area for 10 years, as far as I can tell. So it's been a great opportunity for us to at least put it on the agenda to make sure we've got work, to make sure there is steps going forward so managers know how to support staff, security know what their role is, counsellors have the skills to do this work. So we're still obviously at the early stages. A lot of work's been done, and that's going to be going to the HR network later this month because I was sort of a temporary guardian of that work, but we want to make sure that domestic abuse and mental health aren't seen as the same thing, and that it needs to really have its own mantle and be reporting directly around that. So we'll have a new governance structure by the end of this week, by the end of the year, I believe. I think my mandate was to the end of October, but I've just said, well, I'm just going to hold on to that until it's got somebody to hand. I've got somebody to hand that over to. I can post the link to our domestic abuse website. We also had a webinar around this yesterday, and we'll have the link to that. Actually, I keep going to say on our website. We won't put it on our website because it's around domestic abuse, but we will. That will be available. We recorded it. Lots of fantastic information. Leaders and managers, we know, comes up all of the time in terms of why they are critical in the work that we're doing. We've been working with a reference group around this. We've got online learning that will be released early next year. We're just in the final contract stages of negotiation, so I'll be able to give you more definite timelines around that. But in the meantime, we've got a number of fact sheets, and we recorded our first podcast yesterday that will be coming out around how can managers look after their own mental health and wellbeing, and how can they put an action place in both personally at a workplace level, and how can they support staff. So I'll make sure you're aware of that. World Mental Health Month. Hopefully you saw all of the work we did with that, and a thank you again to FICSA and Tanya for your role in supporting that. So we had a month in October. We suddenly had this idea we wouldn't just make it a day, we would make it a month. We had 4 key themes which link back to the themes of the strategy. I won't go into too much detail, but all of the panel discussions are on our website. We launched social media accounts, so we've now got Twitter and Instagram accounts, which I recommend you follow us on because that gives a lot of the information. The one thing that I think is really important around that first week, which is around mental health and mental health throughout the UN system, we had a number of our UN organisations talking about what they're already doing. So just going back through my memory, so we had IOM, we had UNFPA, we had IAEA. Oh, now I'm going to forget one. I'm going to go back over that list. Apologies to whoever I just forgot. Oh no, we had WFP talking about what they're already doing. We also had the CEO of AXA Asia, who's done a lot of work in this area, and I think it's really important that we're learning from external organisations about what they're already doing. There's already a lot of knowledge in this area. We had people talking about their personal experience, and I thank our colleagues who did that. It was a fantastic panel discussion, and again, recommend you look at that. The third week, we looked at nurturing our own mental health and wellbeing, and what was really good about that and what we learnt was we actually had sessions in each of the different regions in different languages, which was really the first time we'd done that, which is obviously unfortunate, but it really hit home how much feedback we got around that and the importance that we do make sure we have language and regional diversity in the work that we're doing. So that's a key learning for us. And in the final week, we looked at ensuring access for all. So working with partners is critical. So we're working with UN Globe, we're working with Young UN, with the Disability Network and the Domestic Abuse Task Force to make sure we're looking at specific needs. Very quickly, the learnings from this year was obviously plans change, but there can be silver lining around that. Communication, leadership, and engagement is critical, and as is empowerment. So this is why I'm wanting to talk today about how can we empower you, how can we empower everybody out in the field in different UN organisations so that they can take steps. Geography, engaging with intersecting issues, and obviously one of the things that's coming up now is around racial discrimination, so making sure that we're integrating those two messages. We need to make sure we talk about what's going well, but also obviously the challenging stories. One of the pieces of feedback I got when we had people talking about their personal experience was, oh, that they were just so positive stories, like where did things go wrong? And I can tell you for those people, things went wrong, but we also want to be giving the message that it's okay to talk about it, it's okay to be experiencing a mental health condition, and we can have support. The other thing we need to look at is both at a system-wide level, an organisational and on a regional level. And I think that regional level is really emerging as key. So to make sure organisations are working together at a duty station level to put plans in place, we can provide the system-wide support. UN organisations need their own mental health action plan, but then working out what actually happens on the ground. Tanya asked me to talk a little bit about what UN organisations are currently doing. I came back to the themes here because I think that's probably an easier way to do that. But what I guess probably what I can say is most UN organisations are doing something across all of these themes. So some organisations have their own strategy, they're moving forward with that and they're taking action at a really strong level and looking at all of these areas, making sure they've got psychosocial support, making sure they've got a stigma plan and reducing discrimination, making sure they're putting funding into it. And critically, I come back, I'm now calling the first one prevention, Tanya, around what can they do. And this comes, the staff engagement surveys, the providing support around wellbeing at this time. There's a bit more work to be done around psychosocial risks. We were earlier talking about doing psychosocial risk assessments across all of the different UN organisations. It's a little bit challenging about making those decisions. Normally, I think at the start we said, well, we'll wait till this pandemic's over and we're back to normal and then we'll do these risk assessments. I think we've all got a sense that that's not happening anytime soon, but organisations are starting to look at what are their risks, what can we do and what action we can take. So some organisations aren't doing a lot and some are really the front runners. What I have seen over the course of this year is organisations who were resistant or unsure are now taking action. So I think the key question for each of your organisations is, are you putting in place a mental health plan? Have you nominated a senior leader who's actually responsible for this? Do you have a team who can do this work? So if nothing else, I think the first steps need to be put somebody in charge, have a team responsible for this across all of the disciplines, know what you're already doing, know your data and put a plan in place. And as Tanya said, we're working on that template to make that process easier for everybody. I'm going to pause there and I'll let you ask questions around that. I think I've talked about most of the emerging priorities. But we are developing that action plan. We want to push for implementation in all UN organisations. We want to make sure we continue all of the tasks we're already doing, having good training and learning in place, having that training for leaders and managers, looking at administrative issues, highlighting the importance to make sure the advisory panel is really inputting into all of the work we're doing and make sure this is sustainable into coming years. There are all of our contact details. So if you do want to follow us here more, we've also got an MHS email account, or I'm happy to give you my email address as well. So I feel like I've spoken a lot. I put down 3 questions. You might have your own questions, but for me, what's useful is, are there issues you're seeing emerging that absolutely are critical to come into our work plan over the next year? How can we work more effectively with you? You are key. I'm really open to the best way to work so that we're getting messages out through all of our staff federations. And what action would you like to see us taking?
Thank you so much, Therese, for compacting all of that work into a concise presentation, because I know all of the work that you've been doing over the last 18 months, and particularly with particular pressure this year because of the COVID situation. But as you said yourself, perhaps that was the silver lining, that it shone a light on the critical issue of mental health and that we can't keep ignoring it and keep putting our head in the sand about that. Just reflecting very quickly on what you said myself before giving the floor to questions. I see hands up, which is great. I was delighted to see during the Mental Health Month that there was, for the first time, as you said, regional and language sessions, because this is key. And across the board in mental health, there is a distinct lack of resources in different languages and about different regions. It tends to be very much the UK, Canada, Australia, who have the data and the experience, and so it's great to see that the UN is leading the way and pushing to expand that conversation across the regions and in different languages. And because I'm sure that's one of the issues that we face, because we are such a diverse workforce from different languages, different cultures, and we need to understand the root of a lot of those issues and be able to address them in ways that people can relate to, rather than just from an Anglo-Saxon sort of point of view, which I think is very much the case at the moment. So I'm really pleased to have seen that, and I'm one of the best things I think that came out of this year. Domestic abuse, it was shocking. I saw the Secretary General had made a message on that to the world in general, and then to UN staff saying we are not immune to this. We are as likely as anyone else to be victims of domestic abuse, and it's a sad fact. And I was glad to see that stigma perhaps was broken on that issue as well. And also just to draw your attention to one of the discussions we had ourselves in the implementation board was, this is not just an issue for female staff. This also affects male staff, around which I'm sure there's even more stigma. So it's just to raise awareness, and to ensure that you're there for your know what the signs are and see where we can support staff. And as Therese says, this is not a mental health issue, but it's the only place we could put it at the moment. And I was really pleased to see that there was so much effort put into that. And Therese, thank you for taking the lead on that for all of us. Great to see that there's some awareness raising. I think when we come to prevention, and I'm sure Evelyn, for one, is going to get to this, but I know a lot of others will want to do this. What are the issues that are being taken to address toxic workplaces, mismanagement, harassment, those sort of areas that we see as staff representatives that it just are either the cause of mental health issues among staff or else the cause of exacerbating those symptoms for those who have existing mental health conditions. Okay, I'm going to stop there and thank you very much. I see already we have Joe from IMO, and I know IMO or IOM, I never know which way around that is, but I know that your staff councillor Anna is very, very active on the implementation board, so it'd be great to hear from your side of things. Joe, please, you have the floor.
Thank you very much, Tanya. Yeah, it's IOM, and yes, thanks, Tanya, and thanks, Therese, for that very useful presentation. In fact, Anna Eliatambi, our staff welfare officer, is doing a great job. She's been doing so much during World Mental Health Month in October, but also last year for the 10th of October, we collaborated. I think I mentioned it today in your presentation at the Career Development Roundtable in St. Gallen last year. I was in your session and I was telling you a little bit about how GSAC has been collaborating extensively with our staff welfare officer. And now we have a network of an additional 8 counselors based in mainly regional offices around the world, which we never had before. So that's because of COVID. They've been working since June. So really fantastic. They've also been, recently they put out a survey, a staff welfare survey about a month ago, and then shared the results through a global town hall. And also, and they collaborated with GSAC on that as well in HRM. And that was a follow-up to an initial survey that went out about 6 months ago. And they've also been putting out many more information and communications materials. So yeah, lots of collaboration there. Okay, so just 3 points I wanted to raise based on your presentation. One is something I discussed at length with the HR director this morning on our call when we normally talk about cases and things. We were talking about a few cases of leaders and managers in IOM, particularly chief submission, who are fairly senior, P4, between P4 and D1 levels. And this year, some traditionally very good managers who have, some of whom have been chief submission for a long time, have been dropping the ball a bit because they've been getting burnt out. And so here we're not even talking about abuse of authority, harassment in different forms, bullying, mobbing, toxic workplace, in that sense, because those things, now there are repercussions at IOM for those forms of misconduct, and there are punitive measures being put in place. What I was discussing with the HR director this morning, and we don't have a solution for it yet, is those chief submission who have traditionally been very good and now are not able to empathize anymore, don't have patience anymore, they're micromanaging, they're not being kind, they're rigid, there's a lot of rigidity, they're trying to exercise control. It really resonated with me what you were saying about, relinquishing some control to staff. It's been hard for some managers to do that, especially ones who aren't used to flexible working arrangements. It's been really hard. So the problem that we're having at IOM is, what do you do with those long-standing, long-serving chief submission and other fairly senior managers who are now dropping the ball but are not necessarily engaging in forms of misconduct? On those other forms, you can get them. I mean, but on this, and so what, maybe coaching, maybe they need some coaching, they need some brush up on their soft skills, because the other problem is, so the staff are really suffering as a result, their well-being and their mental health. But the problem is they're under so much pressure now to digitalize everything, first of all, but also to chase after donors, because many of our operations have been halted. I mean, we can't provide certain services to migrants and refugees that we could before. So it is understandable they're under tremendous pressure in terms of funding they're responsible for and so many different issues. And staff are really bearing the brunt of it for some of them who are really getting burnt out, especially in the deep field. So this is one issue that IOM yet doesn't have an answer for yet. I'm not sure if other agencies do. A second one is what you mentioned on integrating messages on racial discrimination. And you had a bullet point on engaging with intersecting issues. GSAC, I can tell you, and now the administration as well through HRM and the Office of the Director General, we've been doing so much. We had a podcast, which was 3 hours and 45 minutes broken into 4 sessions over a month. We gathered testimonials from around the world on racism and racial discrimination. We have a virtual library with books available to all of our 15,000 plus staff around the world on racism and so on. And now we're getting a consultant starting from January with funds from the Director General, HRM, and GSAC to do a survey, a global survey, to complement the one that the UN is doing, and also to do focus group discussions, interviews, and that will culminate in a 5-year strategy on anti-racism and ethnicity-based discrimination. From a well-being perspective and mental health, something I've been interrogating a lot in the last few months is, the racial microaggressions in terms of the adverse psychological effects that things like imposter syndrome, things like gaslighting in the workplace, things like internalized racism, and the pernicious and detrimental adverse effects psychologically on people of color in our organization at all levels when they're passed over in terms of recruitment processes in favor of people of the same nationality, and when they're just as qualified or they're more qualified, when they feel that there's a lot of lip service being paid to diversity, equity, and inclusion, but it's not actually happening in practice. And when they start ultimately, because of colorblind, these subtle forms of racism, colorblind racism and cultural racism, internalized racism, and so on, they do internalize and they start to think that they're less worthy, and it gets to their sense of agency and self-worth. This is a major well-being issue. And since we've been taking this up in the last 6 or 7 months through the podcast and testimonials and the rest, I've spoken with a lot of people of color in the organization because they felt they can approach GSAC now because we're stimulating discussion, right? And it's just horrifying, the effects on well-being. So that's another one that I really think needs to be prioritized at IOM and across the UN system. Lastly, so those first two are quite negative, but lastly, I was happy to see the positive stories that you want to have more positive stories. I feel like we don't see enough of those. It's hard to get people, because of confidentiality issues and so on, it's hard to get people to open up about how they went from severe anxiety or depressive symptoms or full-blown clinical depression or post-traumatic stress disorder, PTSD, or any of these other things like burnout or addictions, drug addiction, and so on. We've had several staff who were long-serving staff go into rehab, drug facilities for drug addictions recently and alcohol addictions at IOM. So, how do you get people to feel comfortable opening up and saying, you know what, actually, there is a support network. I am a positive story because I got the help that I needed, and I knew where to turn through the information and communications materials and the webinars and the other means. And therefore, here I am today, a year late, 2 years later, and I'm flourishing. I'm thriving. And not only that, the staff who work under me or with me in my team are also able to flourish and are not bearing the brunt of it. So I think getting the message out through these positive sort of success stories and highlighting them is critical, and I don't see too much of that yet. Okay, so thank you very much. That's it from my end.
Thanks so much, Joe. Great questions, and really thank you for raising the issue of racial discrimination, which is at the top of everybody's list at the moment, and very timely. So thank you for including that. Burnout, I think we all can relate to that, particularly this year, and I absolutely agree with you on the positive stories. I've been Therese is probably laughing inside because we saw videos coming from one of our partners, I can't remember which of the agencies it was, and they were all positive stories, and I said, you can't show positive stories, we have to show people suffering. But you're absolutely right. We do need to show that people can get through this as well. If it's okay with you, Therese, can I just I see Jared and Evelyn also have their hands up, and if we can take questions from them, perhaps them first, and then perhaps we'll do answers, and then if we have time, we'll take a few more questions toward the end. So Jared, please. I'm sorry, I don't know which organisation you're from, so please.
Yeah, hi, I'm Jared. Hi, Therese. I'm Tanya. I'm from the OPCW in The Hague.
OPCW, thank you.
Yeah, and thanks very much for your very informative session so far. The question I had was how you're evaluating the success of your strategies. And the reason I asked this because, you know, sometimes you might have, for example, a toxic workplace, and it could be down to one or two people who are bullying or things like that being the cause of stress. And maybe they move on, and it looks like the strategies you implemented helped that, or did they really work, or is it because they moved on? And so sometimes it's a bit difficult to see, you know, I'm sort of a novice in this, how the things we're implementing, are they successful? And so I want to hear your thoughts about that, please, if you will.
That's great. Thank you, Jared. I think that's a very, very relevant question, and welcome to the FICSA family, and nice to meet you. Evelyn, can you have your hand up as well? And you've been very patient, please.
Yes, thank you very much, Tanya, and thank you, Therese. Tanya, we've been working together for too long. You're reading my mind already.
I know.
Scary. Prevention, obviously, is the thing, you know, and the source of the issues, but a lot was talked about that already. So let me just commend you on how far you've gotten with this. And I think it's great we're talking about this. It's a taboo that was broken and it needed to be broken because it was always there and nobody ever mentioned it. So this is a huge step forward, and it provides the path for more positive action. I wanted to challenge a little bit the concept of control. This is a concept, control and demand, that we had been using in our previous work environment when we are there with our boss and we don't have any control over our work and the demands are high. So now I would say we need to start to think about the new ways of working that are, you know, coming our way. And so far, we also need to change the discourse, I think. It is now less about control. It's other sources of stress. Somehow they have totally changed. Now it's working at home, not being at our desk. Who knows what will happen next year? Will we continue, many of us, to work like that? So we just don't know. And then obviously a lot of fear about job insecurity. We're talking a lot about new contract modalities. Are we going to lose our fixed term contracts, and are we going to be put on short-term contracts or consultancies? So a lot of insecurities around there that I think need to be addressed as well. So I think what we need to think about is going from control to, which is a process model, more to values like trust and humanity and collaboration, flat hierarchies rather than the hierarchies as we know them, because we were pushed towards that. The research groups have been talking about this for a long time before, but now suddenly it all became we jumped closer to that reality. We're still not there, but we're in the process. So these are all new exposures that we need to take into account. And so for all of us, it's a learning process, obviously. And it's not easy, but we need to all think about staying respectful while we're being effective, and also bringing up results during the way which we're working. But obviously, as Joe said, yes, managers also need to let go. They need to let go of this person that is not there physically anymore and breathe down their neck. They cannot do it physically anymore, which causes, again, in a lot of anxiety in them. Will I be able to achieve my results, and so on? So I think we just need to change the discourse, our language, and our thinking in that direction a little bit now, because the initiative started before all this happened. And so I think it needs to adapt. Thanks so much. Over to you.
Thanks, Evelyn. That's an excellent point. And I think the future of work and how it's all going is a cause of massive stress for a lot of staff. But of course, it is an opportunity to build back better, for want of a better phrase. But I do quite like that phrase. Now, I'm sorry, Therese, I did say I'd give you the floor, but I'm going to allow Shireen and Paola very briefly to put a couple of questions as you have your hand up, and then I'll close the floor and I'll allow Therese to answer those questions, because otherwise I'm afraid we won't have any time. Paola, please, and then Shireen. Thank you. Paola, you have the floor. You're on mute.
Hello, everybody. Sorry, I just wanted to come with a couple of comments, because I just wanted to make everyone aware that the Committee on Social Security is already quite well aware of all these issues. In fact, as Evelyn was mentioning, we find this framework of the mental health strategy being useful also in going to discuss these cross-sectorial issues that we are facing with the future of work, namely the contract modality, the agile contract modalities, remote working or smart working, and the all enabling technologies, artificial intelligence, and all the ethical issues that this carries. That's to say that we must accompany staff in this transition. And this is something that can help us also, even sometimes I think that mental health strategy, the name is a little reductive, because it's something that can be seen in such a huge and holistic way, because this can really change the ethical and social behavior, first in our organizations and then probably even a little further. And we as staff representatives, we really have the power to push a lot for this. The committee came about with a couple of recommendations as well. And one of those, I will never insist much. Well, it was on implementations and reporting, first of all, because of course, managers and organizations must also be held accountable. And then on relevant training, as soon as possible, face-to-face relevant training. But it's not only training that we are talking about. As somebody else was mentioning earlier on, we have to use counseling and coaching methodologies, because otherwise the usual training will carry us no further. We need to push counseling and coaching. One counselor in each organization is not enough, not enough. We need to train staff at all levels. We need to train staff representatives, because sometimes we are the first point of entry for people who are depressed or anxious or burned out or harassed or whatever. And if people do not have the skills in active listening, in emotional intelligence, and if managers are not trained in emotional intelligence, in active listening, in supporting people, active bystanders, if we don't have all this sort of training, we will never go far. So sorry to be repeating myself quite a bit, but this is what I wanted to stress. Thank you very much.
Thank you, Paula. Don't need to apologise at all. Shireen, please.
Hi, I can't stress how true what you just said, Paula, because this is what's been happening. Like, we have staff coming in and talking to us in staff association because they're anxious and they can't communicate with their manager or something like that. It's been happening a lot, especially during all this uncertain time. And I also would like to echo what Joe mentioned from our colleague from IOM. The issue with racial discrimination, also the ethnicity statistic for people being more prone to mental health issue, and whether there is some steps that are being taken in the prevention side of it to prevent people from ethnic minority being prone to more mental health issues. Another point as well is the stigma with the mental health, and that's a big issue, whether it's like Joe mentioned, as a coming out story, a success story, or on the other hand, just to come out and express that and have, I don't know what's your view, but we were trying to establish a strategy for that, and within that, I don't know if any of other organizations they have some kind of mechanism of like a safe space where staff can come out, express their concern without fear of being singled out, or if it has to do something with the manager not being retaliated or something like that. We're not also talking about action. We have seen, for example, someone who had a positive story and was like just too anxious to report that story just in case they apply for a position somewhere else, and some of the managers would take that as, oh yeah, this person, I don't want that, him or her on my team. So is there like kind of a mechanism or a anonymous safe space for staff to use to express their concern about that? That should also be very helpful for us if anyone got any views on that. Thank you.
Thank you, Shireen. Therese, you have now 13 minutes to answer all of that concisely and perfectly. Go for it.
No. So can I just check, Shireen, whereabouts are you from?
From IMO, London.
IMO, excellent. Yeah. Thank you to you all for your fantastic questions, and I think some of them I have the answers to, and some of them I'm going to say watch this space, or that's a really good idea going forward. And also wanting to congratulate you all for, I think you're working with organisations who are starting to do this work. Obviously, IOM has been a front runner, and both Michael Emery and Anna have been fantastic. I know IMO is starting this conversation, and I think they took part in the survey, and so I'm certainly having a lot more discussions, and it's one of our challenges with our smaller organisations to think about how do we best engage them as well. Just starting with the issues around leaders and managers, which are sort of kind of different directions. I think it's a really good question, Joe, around what do we do with those managers? And there's not going to be one answer. One of the things I will also keep saying at the moment is we're all dropping balls at the moment. You know, I sent out a message last week about the domestic abuse webinar, which 10 of us looked at, and we had the wrong date on the webinar. And it took me 3 hours to find somebody who was able to change that for me. And I was there having that moment of anxiety. It's like, do you know what? I dropped a ball. And you know what? It's not the end of the world. So I think we do need to have a message that we're tired, people aren't at their best. So we need to find a way that we're not starting with you're bad because you dropped this ball. And I know you're not using that language, because you're talking about people who you're saying they behave, that there's been a change in the way that they're behaving. So that is always a key for me to say, so what support can we offer that person, because it's having a huge impact that's not coming from a disciplinary approach, because what we're seeing probably is their health and well-being isn't great at the moment. So I think coming at those things from a supportive approach, to work out how can we support you. I think the communication about what's been noted is really important. So whether that's sort of at that individual level, it's like, we have noticed that you're not there's been some changes in your behaviour. Is everything okay? What can we do to support you? Because we all know if it comes at if it starts with you've done all these things wrong, we don't react as well to it. So who is the best person to have a conversation with that person, and coming at it from a supportive approach? And we do have information on our website around having conversations, and also we'll be having more of our online learning coming about that. One of our tricks, I think, around leaders and managers is we put them all in one basket, like it's one group, and we're all different. And I think it was somebody from our Ombudsman network actually laid out a really good framework for at the last board meeting, which I'm keen to go back to, around, we do have a group of managers where we just need to give them the tools so that they know what to do to support their staff and they're ready to go. There is no doubt that we have managers in the UN where they are the cause of, they're often the cause of the problem. Simple training isn't going to necessarily make the difference. We've got to put more work into managers who really don't have the skills, the capacity, the desire to be any different. So we need to think about, and those are probably the managers you guys hear about. So I think to have something really specific around not putting all the managers in the same basket. We know doing some generic training, we're developing mental health dialogues for managers so they can have the conversation. Going back to the idea around coaches, Paola, I think that's a really good one. And we've started conversations with the staff college around how can we have coaches and counsellors around the system to be able to support staff. I've slightly paused that piece of work because I think we really, really need to think about the best model for that. And I would like to get input from across the system. So we're not overloading counsellors. We're being really clear about what the role is, and I'll be really keen to get your input as we build that section of it to make sure we're able to offer that across the whole system. So I think the key thing is around the managers who aren't performing and have changed, have a conversation, work out what support they need, or if there's a group of them, work out how do we have a group conversation so that there is an open place for those to talk. I know with the regional coordinators, they've set up a more informal discussion with somebody who's working in this area, and they've really appreciated the opportunity to be a bit more informal, to talk about what are the issues coming up. So is there a mechanism so that you can provide a support level at the, so that they're able to have those conversations? So provide the support to those who need it. We're having the education and information coming out, and then I think we've got a job next year to really focus on that harder group of managers where we know they maybe shouldn't have been promoted to a manager system. They don't have the skills, and a simple online training program isn't going to change that. How do we address that issue? And that's going to be different. And I think we need to really think about how do we create that change, because we know that it has obviously ongoing effects around that. A couple of people spoke about the racial discrimination, and for me, it also comes back to making sure we're integrating our strategies. I think we have a tendency at the UN, so we've got our sexual harassment group over here, our racial discrimination, our mental health. And actually, early on when this became an issue, somebody actually said, Therese, I think you're about to lose your top spot in terms of mental health. Racial discrimination is now the important issue, and you're no longer as important. It's like, hang on a second. These are not separate issues. We need to learn how to integrate these things. So I'm now working with, so say like with UN Globe, looking at LGBTIQ issues, it's like they've got their role, we've got our role. What's the intersecting points so we can have a plan? And I'm pushing that around the racial discrimination. Not all of it is around mental health, but the bit that is mental health and racial discrimination, let's have a joint plan. Part of that will be the mental health implementation strategies board to look at. Part of that will be the structures we put in place around racial discrimination, but let's not reinvent wheels. So I think if you're hearing those conversations around racial discrimination, obviously make sure we're pushing the mental health element, and then that conversation around how do we work collaboratively. So we don't have the racial discrimination groups coming up with a mental health plan that doesn't include what we've done, but we've also learned a lot in the time that we've been doing this work around how do we change attitudes and behaviour. We know that from a stigma and discrimination perspective. So how do we learn from that? I tried to put my hand up to be on the planning board around racial discrimination. I think my nomination got knocked back. But I'm going to go back and push on that one again, because I think it is absolutely critical that we're not falling over each other and seeing these as separate issues. So absolutely appreciate any advocacy you can do in that space as well. Just going back over my notes. So I think, and it probably links with the managers and leaders stuff, Evelyn, around that issue around job control. And I think absolutely great if we can come up with another term. And I absolutely agree, all of those issues around trust, humanity, collaboration are all really important. And I think trust is number one. And I've seen that over the course of this year when I talked about the importance of communications. I know here in New York, when they were saying, this is when you'll come back to work, this is the plan, I just went, you know what, I'm just going to trust them. They're not going to have me back in the office before it's safe, but they will let me know when it is. And then I was perfectly okay with that. We saw so many people across New York who just were really anxious and wanting to tell me the answer, tell me when it will come, all of those things. And I realized that it's not so much around the communication, it's about the trust. So I think trust is even more important at the moment because our health and safety are at risk here. So any ways we can build trust is really important. I still think job control is really important. And I've got to be careful because it's quite a research term, and it's a term that's used a lot in the workplace mental health space. But given the level of uncertainty in the world, I think it becomes more important. And maybe there's a different word that's useful for us to use, but of the things you talked about and knowing the level of uncertainty, we know that the things that we can control are even more important now. So how can we find a word or a way to talk about those things? We also, and be mindful of what we can't take away. So job insecurity still comes up as the number one issue in many of our surveys. We know it's an issue. We can't always change that, but how can we give people so they feel a level of control with something around that? So I think from those questions, and I've got the evaluation one to come back to, don't worry, Jared. I think the key thing for me is obviously that collaboration, making sure we're working together, breaking down some of the issues. And I feel like we're getting close to be able to get to the next level. So we know leaders and managers are important. We're getting there. It was one of the issues I was also asked to pause earlier in this year, and I secretly kept it going under the surface so that we're ready to go now. But we do need to then look at the harder issues around the specific groups that are particularly at risk, around the managers and leaders that aren't going to work on those particular areas, and the challenge around how do we build trust when trust isn't there, and I'm sure you can help me in that area as well. Evaluation is absolutely critical. I will always put my hand up and say we've got work to do. So there is evaluation written into the strategy. There has been challenges in really being able to get evaluation on the table to make sure we're working on this. There has been small aspects happening on that. I've put it front and centre for planning for next year to make sure we've got a really good evaluation strategy in place, and that we're at least offering advice to organisations around how they can evaluate it. So it is an area we need to do better on. It's an area I'm really passionate about. I think, again, something I brought up at my first meeting, but it's not something that is as well integrated as we would like it to be. So, and also any advice in that area are very welcome. I think I've answered most of the questions, Tanya, with 2 minutes to spare. And I will also say I'm really keen to continue the conversation. As I said, FICSA is critical to me. You hear the issues on the ground. There's just like, again, I hear things from different places about what's happening on the ground, but I really do need you, and I need you to be letting me know. As I said at the start, as we're planning the work plan for next year, I'm keen to get your input. If there's things that are missing, absolutely want that. And also, as we're wanting to get information out, you're all critical as part of that process. So really keen to continue the discussion as much as possible.
Thanks so much, Therese. That was absolutely brilliant to respond to all of that in that brief time. I'm going to quickly wrap up. I'm going to start by saying thank you so much, Therese, for everything you've done over the past 2 years. I know the amount of work that has gone in to all of this, and I know the amount of work that still has to be done. I know, like Joe very briefly mentioned, substance abuse. This is part of the mental health and wellbeing strategy. We haven't even started. There's so much to go into that. It's a whole other way of approaching things, but we, you know, step by step. It's great to see the interest in this topic from our FICSA colleagues. It's great to see the active participation. I'd like to invite you all to consult the website. Irwin has put the link on the chat, and it's it's available on our FICSA website. I know Irwin and Evelyn have behind the scenes been having a quick WhatsApp chat to make sure that we have a dedicated mental health page on our on the FICSA website, so that we direct you toward whatever resources there's there. There is a huge amount of resources out there, and we can all add to it. Thank you for doing that again, Irwin. My message to all of you is be kind to yourself and be kind to others, and be ambassadors for this, because I can see that an awful lot of you have a huge amount to say and a huge amount to contribute to this discussion. I am so pleased to see the active discussion. I'm so pleased to see constructive criticism, constructive questions coming forward, and I'd like to propose that we have another session in the new year. I think we'll have a work plan for the implementation board, hopefully by January. And then we'll have our FICSA Council in February, and I hope that perhaps toward the end of February we'll do another session like this and encourage all of you to come with more questions, more suggestions on how we can improve and how we can work together going forward.